Good afternoon. Welcome to Friday afternoon live with me. Welcome to 𝐻𝐶 Academy Reading Live. So quickly, isn't it? I just told you Monday. Now it's already Friday. I'm going to miss you for the next 2 days. Though, very, very, very eager as well, because just to ease you out, because you've been so much of an effort putting in a lot of hard work every time, indulging yourself with study. So we thought, why not give you every 2 days of relaxation period where you can look into the aspects of whatever that we have told you so far for a week, to input it and see whether you are able to use it literally. That's why. Monica, good afternoon. Sidhu, good afternoon. Bangalore. Karuna, good morning. Manipur. Anita, good afternoon. Josie Sargent, good afternoon. Very nice to see a lot of no names. Eager to wait to see if there is anybody who's attending the live for the very first time as well. So Kavita Balaji, good afternoon. Nice to see a lot of people, and at least, whomever is entering, there's always an icon next to your name, which shows that you've been there always, supporting us for whatever that we have been doing. Shine Johnson, good afternoon. So if you have run amongst the others who have not clicked, the very few, please do click the like button, please do click the follow button, please do subscribe to our channels, and also I would definitely request all of you to share the very same link if you feel my classes are beneficial. Narmada, good afternoon. Grishma, good afternoon. Shiny, good afternoon. Jisna, good afternoon. Very nice. A lot of number one, which is there. A lot of love shape is there. A lot of hands, share button, flag, everything is there. So you're all there, isn't it? Rendering your katta support to 𝐻𝐶's family. Good enough. Jilme, good afternoon. Manuja, good afternoon. Have you all seen yesterday? We have posted the winners meet. It's such a pride to see all those gorgeous faces, so happy, making, feeling proud about their achievement, isn't it? That's another big thing that you always have to look forward for. Am I going to be in that, that hot seat where to say, yes, I made to my dream with stunning scores yesterday? There were a lot of students. See, we talk about 400. But yesterday, as Neetu Madam was also saying, see how many students have got to 400 at least. So that is how, we evolve. We always bring that. It's not something new that we do. What we do, we bring in your talent out. Okay, there is nothing gonna stop. When you start deciding, yes, I'm gonna be here to make a difference. Surya Praveen, good afternoon. New name. Shiny, good afternoon. Tangasudha, good afternoon. Thansi, good afternoon. Sanita Sabu, good afternoon. Nice to see all of you right in front of me. So welcome to another live session, Friday. So very good morning, a very good afternoon, and a very good evening to all my lovely students. So see, just to give you a few insights on the aspect. See, 𝐻𝐶's Academy has only 2 Telegram pages. One, an official 𝐻𝐶's Academy Telegram page, and then another one is an exclusive reading Telegram page. We do not have any other group. Although I've been reminding my lovely students, see, there are students being contacted by another fraudulent people, and all this is writing group, that is listening group, we don't have. Okay, we only have 2 groups. One, an official 𝐻𝐶's Academy Telegram page where we have just pinned. So do not fall for these fraudulent people's hand. So that is why we keep on pinning those. And one WhatsApp Telegram page. WhatsApp channel. That's also pinned. Christy Rijo, good afternoon. New name, Rijo. Right. If there is anybody who's attending the live for the first time, please do let me know. Your reading tricks are working for me. Time had reduced. Fair enough, Sidhu. Absolutely, pat your back. I'm only one who's telling. You are the one who is doing. So it's absolutely your hard work. Monica, how am I? I'm doing excellent, Monica. Thank you very much. I hope you are also doing excellent. Very nice, very nice. So nice when students communicate. That gives us that more of what can you say? A sense of pride when they communicate. Shiny, okay, fair enough. Rasna Suraj, good afternoon. Fair enough. Is there anybody who's here for the very first time? Lee Murli. Good evening. Good evening. A new name? So is there anybody who's attending the live for the first time? Please do let me know. ആരെങ്കിലും ആദ്യമായിട്ടാണ് live ക്ലാസ്സിൽ വരുന്നത്. That means in front of me. Nitina, good afternoon. I would love to know where you're from as well. Dharmostin from Kashmir, isn't it? What else could you ask for? The beautiful place of Kashmir. Dar, good afternoon. Josie Sarjanam, second day in your live session. Thank you very much, Josie. Very, very sweet of you to say that yes, you have attended before. So this is what the whole thing is about, isn't it? It's about you communicating towards us. Because the biggest problem that we all have is a small thing called communication. See, when you start communicating, let it be by typing, let it be by, by verbal, either way, it always enhances your core skills. One, when you write, when I read, you're listening to it. When you're writing, you are correcting your spelling mistakes and how you. Monica, nowadays very difficult to come for live because of duty, because I could attend. I took permission for attending a live. Thank you very much. Very sweet of Monica, isn't it? Even though with all the busy schedules, she has gone and taken permission to attend live. This is what. Now my exam's finished. I can also ask for permission. I do completely understand. Do not worry. But I'm sure that what you can say, you will definitely see after your busy period. No problem at all. Reshma, good afternoon. Anuan, good afternoon. So this is how committed our students are. That is what makes us so happy about each one of you. Because in when you're enrolling into us, see, we have an array of exams that we give training. Come what may, we always have a stipulated agenda to make sure that you all are benefited. Okay, we will make sure that you're all out of that comfort zone. But really missing your classes, do not worry, Monica. I'm here all the time. So, of course, even though I would always remember you, do not worry, yeah? On the aspect of even though you are watching the live after. But come what may, maybe whatever the days that you can, please do pop in. That's also another sweetest gesture, which, I'm so proud to say there are a lot of students, even after the exam, they've made to their dream, they've made to the exam, they've made to their dream country, they in between pop up and say at least a hi, which is one of the most beautiful thing any trainer could ask for. So like what I always expect each one of you to make sure that you come and let me know that you made to your dream, and in between do pop in whenever you feel like. Right. So that is all what it is, because I've taken a bit of time on the aspect of reading your valid comments. But I hope this 1 week of time, whatever that you have, waiting for the day when you see my comment and say, congratulations, Dharmos. Do not worry, that day is going to come very soon. All right? Because of your valid effort, that day is not at all going to be long. No sooner you write, the very next day or the day that your exam results get published, you're going to come and say, and I'm going to say congratulations. All right. So yes, without wasting your valuable time, because I know that you're all there in between, busy schedule, doing duty, you have a patient, you have everybody in front of you on the aspect. So I'm not going to take your valid thing. So please do understand, if you have any doubts with regards to any of those things that we do, you're always welcome to contact the number which is there on the screen. April, May, June batch have started. If you want to get some professional approach, you're always welcome to enroll. Lastly, good afternoon. And we're so proud that to say that we have extended our wings to Middle East. We have opened 𝐻𝐿 Academy in Dubai. All right. So it's all like, like things which was always there in our pipeline, and now we'll be expanding to all the places that where you all are, so that you could have a direct approach on the aspect if you need any further assistance. So yes, we'll be starting today's session. So without wasting your valuable time, we'll be sharing the screen. And as soon as the question pops up, do not waste your valuable time. Always ensure that whenever you have that perspective or question come, do that as if it is your exam day question. There you have the material. Please do the material and then we will discuss. Time goes so quickly, is it? By the nick of a time, the question just vanishes in front of you. Fair enough, but at least I have Shine Johnson saying done, Dharmosin saying done, Monica saying congrats, great news. Yes, of course. See, we always thought where. So yes, the first step of expanding our wings, we have come to the land of Middle East. Sidhu done, Ambali Philippi, Shiny done, 𝐴𝐓𝐿𝐼𝐻 done, 𝐿𝐼𝐻 done, Sanita Sabu done, Narmada done, Monica done, good enough. Kavita Balaji done. Right, so nice. Like every time when your names are read, there is at least one icon next to you. Linju Raju, hi, good afternoon. Jisna Sobin done. Nice. So, would you be kind enough to tell me what is your answer? Not just about what is your answer, but to tell me where do you got that answer from? Reshma done. Not just what is your answer, where you got that answer from. That where is quite important for me. Because if I have to correct you, I need to know where you have found the answer from. Reshma done. Okay. Sidhu C from the last para. Okay. Fair enough. So I have my first answer which is coming. Sidhu from last para. He got C. Tansi done. Fair enough. A lot of thumbs up are popping up. So that means all of you have done. Fair enough. Reshma C last para. Okay. Ilakia Raman C last para. 𝐴𝐓𝐿𝐼𝐻 C last line. Monica Vegas C the whole para. Fair enough. Monica C, Anumol Surat C. Yesterday when you were typing, I was literally seeing. So there were a lot of answers, yesterday, which was one such instance where all of you went wrong, isn't it? Monica, Anumol Surat C last para, Jisna C last para, Thansi G last para, Josti C last para. Okay, now all of you are saying C. Anybody else with any other answers? Do not worry of what you have. Whatever is your answer, be happy to shoot. Kavita, C from last few lines. Okay. So it's a very unanimous answer again today. Yesterday also was C, but yesterday all of you went wrong. Today I think all of you are still having C. Let's see if it is right, wrong. Right, now what are the things that you have to be very cautious when you do it? You always remember part B, you're expected to read the question properly, understand the question properly, underline the keywords in the question. And keywords should not exceed more than 3. Try to stipulate it. See, underline the word that you feel, yes, when I see this, I can remember the balance part of it. That's enough. Okay. Now, the material will be popping up back on the screen. And when it is there, Kavita Vijayan is saying, see, we'll discuss. I'll just show you how to look into with the keyword. Now, see, the material is there. Now, see, in this article, do you really need to worry about in this article? No. Now, see, what is important? Why? What can have a significant impact on the aspect of, finding the answers. So, what is important? Okay. Now, let's say, what is the next one to know? The next important one that you have to know is word staff. Okay, now who is that? Staff. Okay, now I'm saying staff is also important. On the word, see, of course, on the word, not really for me. Directed is another important word for me. So what? Staff directed. Enough. See, to do is understood. Now, you have 2 options. You can read the answer options, underline the keywords in the answer option, then pick it up from the paragraph, or you can read the paragraph, then pick an answer. Either way, it's fine. But I'm a person who wants to know what I'm searching for in the paragraph, so I read my answer options, underline the keywords in the answer option. Even the keywords in the answer option should not go more than 3 words. So clinical restraint, okay, is essential. So for me, essential is a word. Okay, in acute mental health ward. So what? Clinical restraint is enough for me. Clinical restraint is essential. See, mental health ward, okay, fair enough. Now option B, when restraint occurs, 5 people need, so 5 is important, need to be present to assist, and 1 out of 5, 1 should be shift coordinator. Okay, they are saying mandatorily you have to have 5, and of those 5, 1 should be shift coordinator. Fair enough. Now, there must be again, see, shift coordinator is there, available, correct process. Okay, so process followed whenever it is needed. So only at the time which is needed. Now, there are 3 different things of which almost everything has very different one. Okay, now first one, clinical restraint essential. 5 people, 1 person should be shift coordinator. They're saying shift coordinator, correct process should be followed. Now read it. Report on patient's unexpected death. So something bad has happened to the patient. Now staff working in the mental health ward of the Townsville hospital have been sent a directive about correct clinical restraint procedure after a patient died unexpectedly. So because of one person have happened, something misfortune has happened to him. Now this is why this memo or whatever is directed. Now, what is the directive saying? A 44-year-old man died in a high dependency unit of the acute mental health ward at about 9 p.m. on July 7th. It is believed that the man may have died from a heart attack, as a male security guard and female nurse attempted to restrain him. They have tried. See, it was unfortunate, but they have tried. The staff memo said it was essential. Now comes the important, because who were the people who gave them the support? One was a security guard and a female nurse. So it is essential that when a restraint occurs, so if it is needed in an inpatient setting, best practice guideline and procedure were followed. So they are saying now, see, it is because of this. So the memo also said it was essential, again the word essential, that a shift coordinator was physically present during all restraint and provide clinical oversight. Not only that he is present, he is going to give them an oversight to ensure the safety of the patient team as well. Not only to the patient, but also for the team. Okay. Now see, there must be a shift coordinator available. Yes, correct processes must be followed whenever it is needed. So very straight it is pointing into C. But see, this is also very common. It is mentioned, yes, a source said. See now, it is not the ward directive. Some other source said, a staff in the hospital who said, the staff in the hospital has also been advised having 5 people to restrain people when best practice. That is not according to the directed thing. It is according to a source. They have found from somewhere that a staff has said that 5 people should be there. So this is not there. This is a straight eliminator. So what becomes the answer? The answer becomes very straight. It is C. So congratulations to all of you. Today, each one of you have got it right. Absolutely good enough. Any doubts with regards to whatever that I've told you? Anything that you want me to clarify? Any doubts? If so, please do let me know. If not, yeah, as what Anita is happy, she's also clapping for herself. Why? Because you have to always know, yes, I am right, of course. Monica is dancing, good enough. I always love when a student enjoys the achievement that they make, because that gives them a lot of morale boost. Okay, Reshma is also dancing, Kavita Balaji dancing, good enough. Keep on enjoying whatever when you make it right. Right, so today's part A we'll be talking about. So we'll be going into today's part A where the material is very similar or very simple. The word, after some time, the word was very short. So I'm really happy. Why? Before that and all, you had to read a lot of big words. Now it is strabismus. Okay? Strabismus. Or strabismus. It is strabismus, yeah? See, generally, a student would be confused because there are places where the R sound should come. There are places where the R sound shouldn't come in. But in this case, it is strabismus, that R sound should be there. Now, next question, as all of you know, what is the time that you've completed and how you felt about today's material? Those are the 2 things that I expect all of you to comment. Why? Because it is very important for us to know how you feel about the material that has been pumped into you. Okay, please be kind enough to tell me an insight on the aspect how you felt about today's material and how many minutes you took to complete all the 20 answers. Sidhu was the first one to say easy and 13 minutes. Okay, fair enough. How about others? And Sidhu was also commenting saying that after practicing, the time is increasing. Fair enough. So that's how we call a process of learning, isn't it? Daily, once you start doing, it starts becoming better for you. Right, because I don't see anybody else going to tell me what and how the material is. So I expect, as what Sidhu said, I expect the material to be easy. Now let's go and see what are the things that you have to look into when you're doing part A. See, when you're doing part A, the first and the foremost important thing that you always have to be aware of is you should know what is the strategy. See, the strategy for part A is called skimming and scanning. Grishma took 14 minutes. Fair enough. So as soon as the material pops in, you will see that part A. So it is called skimming and scanning. Now skimming yesterday, because when you ask, we always comply. So you wanted us to repeat. So yesterday we have already repeated what are the keywords. I've already commented. All right, fair enough, Monica. Thank you very much. So skimming means quick look. Okay, you have your material will be there in front of you for 15 minutes where you will have to tackle 20 questions. Okay, now why I keep on emphasizing this 15 minutes, 20 questions? See, there are students who still doesn't realize the importance of doing with a purpose. Okay, see, one suggestion to each one of you is, see, when you are in a class to learn, when you are in front of anywhere, no matter wherever you study, when they say, okay, you are expected to find all the answers, you have to find the answers. Why? See, that is what the purpose is, isn't it? Can you do that on the day of exam and take a gamble? No, try to do when you're practicing. See, whether it is wrong, don't worry. Do right. That's the most important factor. Kavita Balaji, 12 minutes. Okay, fair enough. Fair enough, fair enough, fair enough. Right. Now, what are the things that you have to be cautious about? See, please understand there are 4 texts which will be based on one common theme. One common theme today is strabismus. Okay, 4 texts A, B, C, D, likewise you have. So when you're skimming, you should be able to differentiate what A has, what B has, what C has, what D has. Okay, so likewise you are expected to differentiate. So see, for example, as what you go, see, strabismus or crossed eye. So crossed eye is a condition where 2 eyes and does not face the same direction. Is usually accompanied by uncoordinated eye movement and lack of depth perceptions. So there are 6 muscles in the eye controlling and the theme points in the same direction. In strabismus, they do not work together. Instead, the strabismus, one eye is looking target, while the other eye looks at the another design. Common in children and is known to be more in families. And the other disorders may include cerebral traumatic brain injury, congenital rubella, 𝐴𝐵𝐶, strabismus in adults. So accident head injury, damage to eye muscle, health problems such as Graves' disease, myasthenia gravis, brain tumor, stroke, shellfish poisoning, Guillain-Barré. So they're given you. So what do you understand from text there? It is called this. It has 6 muscles have to work in relation together. So if one thing goes, it is more common in children. What are the problematic things that children have? What are the issues where adults have? So diagnosis. So what are the ways to find it? So a retinal exam, corneal light, and cover, refraction, examination of eye health, family history. Done. So text C, complication, incident, risk factor, key reference. So these are very important. So anything about a complication, go to C. Anything about incident, go to C. Anything about risk factor, go to C. This is how you should differentiate. Text D, corrective methods. So what are they saying? They're saying eyeglasses, contact lenses, prism lenses, orthopedics, medications, patching, eye muscle. So all those things. Now I know what are the difference. Okay, A is about this, B is about this, C is about this, D is about this. Understood? After this, you go to your question. See, we have 20 questions divided into 3 types of questions. 3 types of question. The first one, 1 to 7, match the following questions. You have to identify this. You have to understand this. You have to by heart this. So instruction A, B, C, D. You may use any of these letters more than once. See, if your skimming is proper, that means your underlining keywords is proper. 1 to 7 is just a piece of cake. Just about referring. Now see, strategy doesn't change. Okay, you have to underline the keywords in the question as well. So negative outcomes commonly associated with strabismus surgery. So where are they talking about all these complications? Negative outcomes. C, is it? Complication there. So all those things are mentioned. So that is it. This is how you should identify. See, pharmaceutical intervention, medicines, treatment where? D. Understood? See, you do not have to worry too much if your skimming is proper. Now see, elements involved in the development of strabismus in adults. So what are the causative factors mentioned in A? A lot of symptoms are mentioned. A lot of accidents, all those things are mentioned. Done. See, strategies, methodologies that can be employed to alleviate diplopia. Diplopia means double vision, isn't it? You know that. See, they test your a bit of knowledge on the aspect of these kind of things. They do not say double vision. They say diplopia, another terminology for it. Now, where are they talking about double vision? Is it there? Where are they talking? There is only one place where they talk about double vision. That is only in D, isn't it? So, this is how you relate to it. Understood? So where are they talking? See, this is double vision. So this can be done to do. So done. The adverse consequence from surgery, unhygienic. So adverse result, complication. That is it. Now if you want, because you are people who always want to know where it is, isn't it? Poor hygiene. Done. Understood? Now, what is a significant factor for strabismus in children? So, children, where are they talking about? A. Now, is there anything necessity? No, but still, strabismus in children is known to be causative factor is family history. Assessment test. So, where are they talking about test? Diagnosis. B. Done. Okay. Now the next set of questions. These next set of questions are called short answer question, which starts from 8 to 14, where the instruction is it can be a word, can be a short phrase, it can be words or numbers or both. Short phrase should not exceed more than 2 to 3 words. Sidhu, Grishma, Shaheen, all 7. Akila, 7. Very, very good. A lot of 7ers. Good enough. Reshma, 7. Kavita, Akila, all 7. Good. Fancy 7. Nice, nice, nice. Nice to see a lot of people with 7. Now let's go to the next set of questions. Even though the question pattern changes, the strategy doesn't change. Okay. So what type? So type is mentioned there. Of injection also is asked. So medicine somewhere. So medicine, where is it? Excessive active, 𝐼𝐴. Anita Joe's first time I got 7. I've just repeated enough. Keep it up. Now, where are they talking about? Medication is there, injection is there, type also there. So what is the injection? Botulinum type A, toxin A, sorry. Type is already there in the question, so you don't need that. So botulinum, BOTULINUMTOXINA. That's it. So it is with that 2 to 3 words also. That's how you do it. Okay. Now next set, question. How many? So definitely a number. Muscle. So I know that I have read somewhere saying that it is 6. So collectively coordinate with both alignment simultaneously. Yes, it is there in A. Why? There are 6 muscles that control works to the same direction. That is it. So 6 is the answer. Again, next question. What is the alternative designation name for strabismus? Again A. Why? Crossed eye. Strabismus or crossed eye. Done. CROSSEDEYE. Which technique? Technique where? Where is technique? Is it there in B diagnosis? Yeah. Appropriate gauging of the eye's precision in focusing light with accuracy. So where are they talking about light, accuracy and all? Are they saying somewhere? Yes, isn't it? It is performed to check how your eyes focus on light. Which one? Refraction. REFRACTION. What is the term for strabismus treatable with eye exercises? So where are they talking about treatment? Treatment should be there. So with eye exercise, what are they going to treat? Yes, they're going to treat which one? Which one? Tell me. Waiting. See, an eye exercise that is to treat is what? It is your what? Tell me. With eye exercise means orthoptics, not patching. Patching is not an eye exercise. So make work on some type of strabismus, especially with convergence insufficiency. So CONVERGENCEINSUFFICIENCY is a form of extropia. So patching is not an eye exercise, is it? See, the question is what? Which technique, eye exercise. Understood? So that is orthoptics, isn't it? Orthoptics is an eye exercise. So which one? Especially convergence insufficiency. So CONVERGENCEINSUFFICIENCY 𝐼𝐶IENCY. Good enough. Now, in the corneal right reflectex, which specific ocular component is examined? So, corneal right test where? Go straight to B. So, corneal, it works with the cornea. CORNEA. Now, question number 14. Who are most susceptible? So, somebody who is prone, who is more prone to. So somebody who is very much. So we know children is mentioned in A, adults is mentioned in A, but somewhere else. Why? Conjunctival infection post strabismus surgery. So complication. So who is more prone? Conjunctival injection is there. So who is more prone? Older patients. OLDER, Very good. So the final set of questions, these are called fill in the blanks question. Instruction remain very similar to short answer question, but redundancy should be looked at. Dash is a post-operative risk, particularly in pediatric strabismus surgery. Pediatric, often concomitant with factors like myopia and recession. So again, some complications. So complication is should be in C. So myopia, where is myopia? Myopia anywhere mentioned? Yes or no? So myopia is there, recession is there, surgeon inexperience and all that. Scleral perforation. SCLERALPERFORATION. A two-word answer. Strabismus typically manifests in tandem along with misaligned eye movements, impaired dash due to lack of coordination. So coordination and all those things, where are they talking about? It should be there in A. Why? It usually accompanied by uncoordinated eye movements along with the lack of depth perception. DEPTH, Excellent. Dashed lenses are specialized optical devices designed to manipulate the trajectory of incoming light to alleviate diplopia. So again, I said double vision. We have already encountered double vision. Go to D. So where are they talking about D? They're saying in D. Where are they saying? So what is used? Prism lenses. These are special lenses entering the light to relieve double vision. So prism, PRISM. Very good. The etiology of causes of strabismus frequently lacks discernible origin and is presumed to lie primarily in familial predisposition. So where are they talking about familial disposition? Family history and all. Yes, family history is there. So strabismus is more in children. CHILDREN. The penultimate question for this week, the concurrent manifestation, co-occurring manifestation, dash and strabismus is typically addressed through therapeutic intervention. So who are they addressing through therapeutic interventions? Therapeutic interventions, yes, it is there. So what are they addressing? What are they addressing? So this is one. So to treat amblyopia, AMBLYOPA, because at the same time improving. So that is the next keyword, or strabismus. So amblyopia, AMBLYPOPIA. The ultimate question. So co-occurring, okay, along with strabismus. That's what the answer is. The dash of each eye undergoes assessment as one eye is covered, discerning the extent of ocular movement. So go to D. So something is there. Where is it? So during the visual acuity, each of the eye is tested by covering the other eye. So visual acuity, VISUALACUITY. Clarina High, Narmada High, not uncovered test, yeah? So what has been assessed? The visual acuity of each is assessed, yeah? It's not which test. So I have wrapped my 20. Monica is already dancing. So may I know what are your total scores? Reshma is saying 18, absolutely good enough. Good enough. Akila is saying 18, good enough. Greshma 18, okay. The consistent 18 today. Fair enough. How about others? Kavita, could you explain question number 12? See, what is the problem? Tell me. See, a type of strabismus. See, eye exercise. Eye exercise is called as orthoptics. Okay, that is where you exercise. That is the only reason. See, instead of putting orthoptics, we just paraphrased and put synonyms. Eye exercise. Understood? Because patching is not an eye exercise, no? Understood? Sidhu 17, Jilmi 17. Good enough, good enough. Clear, Kavita? Right, I hope it is clear. So because, yes, there is no doubts. Okay, thank you. So because there is no doubts, it was a pleasure having you all for hosting you for 1 week. I'm going to miss you all for the next 2 days. Until and unless I see you all on Monday, have a blessed weekend. God bless you. Have all lovely weekend. I'll see you all on Monday. Adios from me on behalf of Neetu Sandhi. God bless you. Take care. Bye.